Hello friends, I'm Shaurya Mishra. Welcome you to your own YouTube channel, Vision Care Advisor. Friends, I'm continuing the one-liner series in ophthalmology, and these 51 liners will help you to solve all type of MCQs. So, without taking much time, let's get started. Horner Trantas spots are seen in vernal keratoconjunctivitis on the upper limbus. Vernal keratoconjunctivitis is also called shield ulcer. On the upper tarsal conjunctiva, cobblestone appearance is seen in vernal keratoconjunctivitis. Fascicular ulcer is seen in flectanular conjunctivitis. The eyelid is made up of epidermis, dermis, the orbicularis oculi muscles, the orbital septum, the tarsal plate, and the palpebral conjunctiva from superficial to deep. The epidermis is composed of the layers keratinocytes with melanocytes, Langerhans cells, and market cells. The basal layer of epidermis is the innermost layer and composed of a single row of columnar-shaped cells containing melanin from adjacent melanocytes. The dermis is composed of delicate collagen fibers containing the vasculature, lymphatic, eyelashes, and nerve fibers, glands of G's, glands of mole, eccrine sweat glands, and sebaceous glands. Glands of G's are sebaceous glands of the eyelashes concentrated at the lid margin. Glands of mole are modified apocrine sweat glands that open onto eyelash follicles. Eccrine sweat glands are distributed throughout the eyelid skin. Sebaceous glands are located in the caruncle and within eyebrow hairs. These tiny glands are associated with the thin hair covering the periocular skin. The orbicular oculi muscle is a muscle located in the eyelids. The orbicularis oculi muscle is a sphincter muscle arranged in concentric bands around the upper and lower eyelids. The orbicularis oculi muscle is composed of thin, circularly oriented skeletal muscle. The orbicularis oculi muscle closes the eyelids and assists in pumping the tears from the eye into the nasolacrimal duct system. The orbital septum is a thin, fibrous connective tissue layer that separates the eyelid structure from the intraorbital structures. The tarsal plate is the main structural component of the eyelid. The tarsal plate is made of dense connective tissues and contains meibomian glands, eyelash follicles, the middle muscular bundles, and the surface epithelium. Meibomian glands are sebaceous glands that secrete an oily substance with a critical lipid component into the tear film that helps to decrease the evaporation of tears. Angular conjunctivitis with a whitish discharge at the outer canthus is called bimoraxilla lacunata. Treatment of choice in angular conjunctivitis is zinc oxide. Moraxilla lacunata is a rod-shaped gram-negative bacteria. Aphakia can be treated by wearing glasses, contact lenses, artificial lens implantation, or refractive corneal surgeries. Most common cause of viral conjunctivitis is adenovirus, and occasionally herpes simplex or zoster virus is responsible. The lacrimal apparatus of the eye produces lacrimal tears in order to prevent dehydration of the eye. The lacrimal apparatus is composed of lacrimal gland, lacrimal canaliculi, lacrimal sac, and nasolacrimal duct. The lacrimal gland is a serous, compound tubulosinner gland that resembles the parotid gland. The lacrimal gland secretes tears via ducts that open into the conjunctival sac at the lateral portion of the superior conjunctival fornix. Tears are composed of water and an antibacterial agent that is lysozyme. The lacrimal canaliculi drain the lacrimal fluid away from the surface of the eye via the lacrimal punctum. Lacrimal punctum are lined by stratified, non-keratinized squamous epithelium. The lacrimal sac is dilated portion of the duct system. The lacrimal sac is lined by pseudo-stratified ciliated columnar epithelium and contains numerous goblet cells. The nasolacrimal duct delivers the lacrimal fluid to the inferior meatus on the floor of the nasal cavity. The nasolacrimal duct is also lined by pseudo-stratified ciliated columnar epithelium, just like the lacrimal sac. The most common cause of unilateral proptosis in children is orbital cellulitis. The most common cause of unilateral or bilateral proptosis in adult is thyroid ophthalmopathy. Drugs of choice for uveitis is steroids. Night blindness is called nyctalopia. Night blindness is a condition in which patient has decreased vision in dim light or night. Day blindness is called hemeralopia. Day blindness is a condition in which patient has decreased vision in daylight or bright light. Anterior chamber depth is shallower in hypermetropic eye than the myopic eye. Anterior chamber is also shallower in children and in older people. Anterior chamber is slightly shallower in hypermetropes and deeper in myope, but it is almost equal in the two eyes of the same individual. The anterior chamber communicates with posterior chamber through the pupil. The posterior chamber is a triangular, narrow space in the eye that is behind the peripheral part of the iris and in front of the suspensory ligament of the lens. Central retinal vein drains the blood from the retina. Anterior ciliary veins, short posterior ciliary veins, and vortex vein drain the blood from the uveal tissue. Inferior venous network lies near the orbital floor in an anteromedial to posterolateral axis. Superior venous network is smaller and lies above the levator palpebri superioris muscle. Thank you for watching. Stay tuned for more updates and don't forget to like, share and subscribe. Please do remember to check your vision yearly and see the world clearly.